Right, and we are live. We are live, and we want to get everybody ready to discuss this evening the science of COVID-19. So, we're inviting everybody to hit that share button. We've got a great panel lined up for you this afternoon. So, go ahead, hit that share button, get your friends, get your family, tell everybody something great is about to happen. You're about to learn something new tonight. I know you have heard it on the TV. I know you have listened to press conferences, but there's something new coming tonight on the subject of COVID 19. We recognize that as we look around our country and around the world, we are grappling with this coronavirus disease. Around the United States, there are over 610,000 confirmed cases, and about 46,000 have recovered, and about 25,000 have died. And here to discuss this very interesting subject of this COVID 19, the cause, the complication, and the countermeasures. I've got a great panel this afternoon to discuss this evening, this conversation. In the center of your screen, we have Dr. Michael Knight. Dr. Michael Knight is a physician and assistant professor of medicine at the George Washington University School of Medicine and Health Science. And I must say, he is a proud New Yorker. And even though there's down there in Washington, D.C., he currently serves as a patient safety officer and practices clinically in internal medicine and obesity medicine at the George Washington University uh, Faculty Associates. Outside of his clinical role, he serves as the founder and president of the Renewing Health Foundation, a nonprofit organization working to empower urban communities through health education. Dr. Knight, welcome tonight.
Thank you.
Great, great. Good to have you. And we've got Dr. Wilmore Webley. Dr. Wilmore Webley comes to us from the sorry, University of Massachusetts Amherst. He's currently a tenured associate professor of microbiology and the director of pre-med slash pre-health advising at the same university. He also serves on the editorial boards of the International Journal of Vaccines and Immunization, the Journal of Medical Microbiology and Diagnosis, and Microbiology and Experimentation. And he's a member of the International Society of Vaccines, American Society of Microbiology, and I know that I'm going to learn something here tonight because he has been recognized for his role with the Ebola outbreak, having hosted a panel moderating that back in 2014. And we just want to welcome you, Dr. Webley.
Thank you very much for having me, Dr. Wellington.
Great, good to have you. I'm looking forward to a great conversation. And for purposes tonight, I am the patient. So you can just call me whatever you want to call me, and you use me as the guinea pig in any of your experiments or your illustrations or anything like that. I volunteer myself without any reservations.
All right, sir, we got you.
All
All
right.
right. Great, great. All right. So, as the folk are sharing, I'm sure they want to know a little bit more about you. So, I'm just going to give you an extra 30 seconds just to, Dr. Knight, tell me a little bit about Renewing Health. What's Renewing Health Foundation? While everybody's sharing this message, and we want to get that 30 seconds, and then we get a 30 seconds from you, Dr. Webley, on exactly what you're doing with your students and the vaccination process up there in Massachusetts.
Yeah, the Renewing Health Foundation was founded in 2012, so about 8 years ago, focusing on health education in the minority community. We've done a lot of programming, particularly in the New York City metropolitan area, with our Purpose and Passion in Pink program, which is a breast cancer education program, as well as a variety of other initiatives. So this is a part of my passion, which is getting factual health information out into our communities.
All right, great, great, great. And we're about to share some facts here tonight. Dr. Webley, tell us a little bit more about what you do and how you're working your thing with your students over there at the University of Massachusetts.
Well, thank you. As you mentioned, I'm an associate professor in the Department of Microbiology, where I run a research lab. My area of specialty is infectious disease and immunology. I train students, both graduate and undergraduate students, in my research lab, where we do work on infectious disease pathogens, specifically chlamydia, both the sexually transmitted and the respiratory forms of chlamydia. We also look at the role of various pathogens, bacteria, viruses in chronic diseases, including asthma.
All right, all right. That's a lot to learn from us tonight. I'm going to be the patient, so let's shoot at it. Doctors Knight and Webley, what is from your scientific background and training, where did this COVID-19 or coronavirus come from? Was it invented in a lab? Myth or fact? Did it come from a bat or an animal? Myth or fact? Who's going to take it first? All
I'll
right,
take
I'm
it.
going to hit. All right, let's go. Go ahead now.
So bats are a reservoir of tons of different viruses. And we know that the SARS coronavirus that we experienced an outbreak in 2002, 2003 also came from a bat. It had an intermediate host, the civet cat. And from there, it got transmitted to us as humans. It is the closest known virus to the current SARS-CoV-2, which is the coronavirus that caused the current outbreak of COVID-19 in terms of molecular or genetic sequencing. And that it appears that that virus also came from a bat. Now, there are a lot of theories and conspiracies as to how it got from a bat to humans, but it's not a mystery, so to speak. We know it came from a bat. We just have to find out by tracking and tracing what the intermediate host is and where the exact location is that it actually jumped species. But these types of zoonoses are pretty common.
Well, some governments, I'm going to ask you, Dr. Knight, to jump in on that too, but some governments are disputing that fact, or saying that, this needs to be investigated because it may not have been from a bat. Is the science conclusive that it is?
I think the evidence that we've seen so far, as was just outlined, does point that way. Like we said, coronaviruses are not new. Coronaviruses are a family of viruses, and we see them in a variety of species, humans, as well as in different animals. So I think what we really see is this desire to know, who's responsible. It's hard to point the finger at an animal. But it's a little bit easier when you think that potentially it's a lab or some kind of undercover operation. So I think we're seeing some of that, but we have to stick with the data. And the data so far does not outline any kind of undercover plot for where the coronavirus originated.
All right, so we're debunking conspiracy theories here. There is some scientific evidence to this thing. Now, I'm concerned now, what makes this such a deadly virus? What makes it so different from the other families of coronavirus? Because I just learned about all of this, trying to do my research to make sure I'm as up to date as you guys. Tell us what makes it so different.
I think the major difference here is not that it's as deadly as it appears now. The reason why it appears that it is so deadly is because we haven't tested enough to see what the denominator is. I think when it's all said and done and we go back and we're able to do antibody tests, we realize that the case fatality rate is way lower than we're seeing now. What we know is that it is extremely contagious. It has a very high affinity for the ACE2 receptor, which is the receptor on our respiratory epithelial cells that it binds to in order to get into our airway and start the disease. So it has a very high affinity for that receptor. And as a result of that, it's very contagious. To add to that, we know that this virus now can be transmitted before the patient starts showing symptoms. And some of these patients never really show any overt symptoms. And that makes it very easy to transmit from one person to the next. since we don't know that the other person standing beside us actually has the virus. Hence the measures that we've taken to social distance or to physical distance from people in order to prevent that transmission.
So are you saying then that this physical distancing actually works and actually helps in the process since they don't come fully understand the dynamics of this virus?
For sure.
I would say yes. What we're seeing is understanding how we think it's being transmitted from person to person. We think about the respiratory droplets where we think the majority of transmissions are occurring. They're only traveling so far. I think we've been seeing some new data about just how far that may be. Maybe it's 6 feet, maybe it's a little bit longer, but we think the majority are within that 6 feet distance. And that's where that came from, encouraging people to keep that distance from others. It's not 100%. But we know that it does reduce the risk of transmission.
So does that make that is it then conclusive that it is then airborne in its transmission? Is that a conclusive science?
Yes, it is airborne. If you sneeze or if you cough, then you can transmit the virus that way. We also know that if you have these droplets after you've sneezed and coughed, or if you cough or sneeze in your hands, and it's on a surface, you can also pick that up on the surface, on your hands. And if you put your hands to your face, it can also be transmitted that way. It is likely that it could also be transmitted through fecal matter, since we know that there's a lot of shedding in the feces. But by and large, this is a respiratory transmitted virus.
Yeah. So I guess so. What makes it if you cough or you sneeze or so, how long then does this stay airborne? How is it there forever? Is it there for 10 minutes? Is it there for 15 minutes? I was watching something online that it's like a micro of a micro. I don't know if you have something you want to share on that,
Yeah,
Doctor.
let me share something here on this, because I
All
think
right,
that might
I'll add
add.
it right there. All right, go ahead.
Mhm.
All right, you
So
got something
you
you want to share with us?
right. So you'll see there. Are you getting the shared slide?
Yes, sir. Getting the share.
Right. So if you notice there, you'll see that in aerosols, the data shows that the micro droplets, not the large droplet, the large droplets fall to the ground pretty quickly, but the micro droplets can actually hang around in the air for 2 to 3 hours. On certain surfaces like copper, we know that it can exist for a period of up to 4 hours, but then you start looking at smooth surfaces like plastics and stainless steel, and it could be there for a few days. On cardboard, because the cardboard is porous, then it actually gets trapped into the porous areas of the cardboard, and it's not there for too long. The question then becomes, how many viruses does it take to cause an infection, and how many viruses landed on that surface in the first place? Because that is going to determine whether or not you can actually get an infection from those surfaces after 2 to 3 days. And it would also depend on the exposure time to sunlight or to direct light, because that also kills the virus.
All right. That is good info. I'll just leave that up for the screen for just a quick moment there, so that they could look at that. All right. So we've got a question here, and feel free to jump in on and share your question. We're monitoring our Facebook feed live. So if you have a question for the panel, please feel free to share that question, and we will share it with the panelists. We've got a great panel here, Dr. Michael Knight and Dr. Wilmore Webley. All right, so here we go to a comment from council member. All right, here we go. Council member Andy King. He is saying, blessing pastor. Question, is this virus a killer by itself, or does it need other variables to kill? How long does a virus live on the norm? I think that's a great question. Take it away, Dr. Knight.
So when we say killer virus, we have to understand what's happening to people who are succumbing to this, right? So when we're infected by a virus or any pathogen, and that's a word that we use to say bacteria or other things, it's how your body responds to it. So you have individuals who may have a very strong immune system and may not have an immune response or may not have symptoms at all. Then there are other individuals who are developing fever, developing a condition that we call a respiratory inflammation. And that's basically your body's responding to the virus. So it's really a lot of what we're seeing as far as that severe outcomes in patients and severe symptoms are a result of a severe immune response by the body to this virus. So that's why it's a different reaction for different patients. Some individuals have no symptoms. Some individuals have unfortunately passed away because of the way their body has reacted.
And so is that then fair to say that there is no known science yet on how it fully acts on the body once it gets into the body? Is that a fair assessment?
I think we're still learning about it. You know, what we have to understand is a lot of the recommendations that we had in January and February were based on what we know about the coronavirus family. Now that we're finding out more about the specific strain, we're hearing recommendations are changing. Recommendations about everyone wearing a mask, recommendations of how long or how distant you need to be from someone. We're learning a lot more. So as we see the data and start understanding the receptors that is affecting, why one person may have a severe outcome versus another, then we can have that. But right now, the data is just very, very light because it's relatively new.
What we do know, though, is that we know that if you're immunocompromised, this virus takes a greater toll on you. If you have had other respiratory diseases, COPD, asthma, if you have had heart disease and diabetes, that this virus takes a greater toll on you. And that is probably generally true for any sort of infection like this, that if you're already immunocompromised, for example, if you have HIV and you're immunocompromised because of HIV, if you're in the later stages, then this virus could also take a toll on you. Why? Because once it infects the airways and it gets into the lower airways of individuals, then what starts happening is a pretty strong immune response. Your immune system knows that the virus is there because the cells that are infected put out very specific chemical messengers to say, hey, I'm in trouble, rescue me. And the cells that they draw into the airways, the neutrophils and the macrophages, it's like bringing in the National Guard or bringing in the army into your neighborhood. They're going to beat down your gardens. They're going to trample your lawn. It is going to make a mess. And this is essentially what happens with individuals. They have what is called a cytokine storm. And that cytokine storm is really your immune system responding to the presence of the virus. If that is not brought under control, then that individual could go into respiratory distress.
Now, is there fact or fiction for both of you, Doc? Does COVID-19 have an impact on cardiovascular system in terms of outside of respiratory? Does it impact heart failure or anything like that? Cardiac arrest?
It has to, right? So let's say that you have a respiratory insufficiency. Let's say you're not bringing enough oxygen. What's going to happen with your heart? Your heart is going to pump harder because your body needs the oxygen. And here you have in your lungs, you have all this fluid in your lungs that's built up so that you're not having the oxygen diffusing through that thin layer in your lungs. So let me pop something up. So essentially, this is a page looking at the pathology that one typically see. And in the severe cases of the disease, this is inside of your lungs. This is deep in your lungs in what we call the alveolar sacs. This is where oxygen exchanges. Carbon dioxide gets taken up and you exhale it. Oxygen gets exchanged. It goes across the membranes into the blood supply where it gets onto the red blood cells and get taken to the rest of the body. Now, it's the job of your heart to pump blood around the body so that you can have, as a part of the process, oxygenation. If you're not getting enough oxygen and you're hyperventilating, that puts a pressure on the heart. So if your heart is already damaged, or if your heart has any issues, then of course you're going to exacerbate the condition. Of course, this is on a continuum from somebody having a mild disease to somebody having a more serious kind of heart problem. But if you have any of those types of issues with your heart, with your lungs, then it stands to reason, logically, based on the physiology, that this virus could have a greater impact on you.
All right.
I want to say
Go ahead,
something
Dr.
quickly on that, Pastor Wellington, before you move forward. I think one of the things to understand is, many people don't know what the status is of the function of their heart, of their kidneys, a variety of things. When we think about heart attacks and strokes, most people who have those don't have pre-existing conditions that they may have known about. Some of them do, but not everyone does. So you may say, I don't have a heart condition, or, I have never had a kidney problem before, but you may be developing very low levels of disease that hasn't been detected. But in the setting of extreme stress, as was just outlined, that you may be under with an infection like coronavirus, that's when we start seeing these things come to the surface. And that's why we're seeing heart attacks, we're seeing strokes, we see kidney failure. You have to understand that when your body is in a stress response, when it's fighting for its life, all of the organs are going to be stressed. And so that's why you see effects on a variety of areas that you say, well, I thought this was a respiratory virus. Why has this patient had a stroke? You have to understand that when your body is in this extreme stress response, we start seeing effects all over.
So prevention, in terms of preventing yourself from getting it, and if you do get it, how important is respiratory exercise such as running, jogging, walking? Does that do anything to help in the process? Any at all? And we know you're not prescribing treatment for any patient, just a general question.
Mm-hmm. I think we have to think about it in two stages. So when you talk about prevention, theoretically, yes, if you have a better breathing system, if you're exercising, if you're conditioned, then it's okay to assume that your respiratory system is going to be healthier, so that if you were infected, you may have a better response. But that doesn't mean that running is going to prevent you from getting the coronavirus if you are encountering someone who is transmitting it to you. So we're really thinking about ways that you can prepare your body so that you may not have such a severe response. So that's where things come in that case. We know that individuals with underlying lung disease or who have a poor physical condition, if they're infected, we can see a more severe response because their body is not prepared for that onslaught. So I don't think it prevents the infection, but I do think it can work to prevent a severe outcome as a result of one.
All right, we've got some more questions online there. We're going to go to them in a second, but since we're on this, Dr. Webley and Dr. Knight, so your immune system needs to be strong to be able to fight this virus. Some folk have said it's similar to the flu. I'm not going to go into that discussion, but I want to know, should you boost your immune system once you have gotten this, because you're pretty much nobody's immune. Such things as vitamin C and other vitamins, does that help once you have contracted it? Does that help in any way, or is it too late?
I think it should help. What you're trying to do is that you're trying to give your immune cells a fighting chance. Your immune system is eventually what's going to help you to clear the virus. It's not clear mechanistically how that actually happens right now, because a report came out yesterday that showed that there are people who got better from the virus and didn't have what we call neutralizing antibodies, which is kind of surprising that would happen. But I think anything that you can do to stabilize your immune system would be good. Overdoing it, taking tons of supplements, is probably not the best thing, because you could overload yourself with these supplements.
Mm-hmm.
Anything extra you have could actually attract other pathogens. If you're loaded with stuff that they can use, then they will invade and take over as well. So you want to be moderate in what you're doing. If we're eating right already, if you're already taking in the right amount of nutrients, there's no reason to overload yourself at the time when you actually contract this virus.
All right, great. So we're going to take some questions and then we'll continue on the path. Let's take Dahlia Reed. She asked a question: can an individual who had the virus, can they contract it a second time? And that's similar to this question by Parasa. I'm going to say, when we recover from COVID-19, do you think that should be I suppose it will be possible to be impacted again? So two similar questions.
Yeah, I mean, at this point, I would say most likely you would have protection. From what we've seen from other coronaviruses, including SARS, people who get infected with the coronavirus, typically when at the time when they are convalescing, they have high titers of neutralizing antibodies against the proteins that the virus used to attach to the cell. And those, when they bind, when the antibodies are Y-shaped proteins that the body produces in order to bind to these viruses or bacteria or whatever pathogen you have in the body. So that would be the thought that happens. Does that happen in everybody adequately? That we don't know. It is very likely that some people probably don't have as high a titer as other people. And it's not clear at this point what would happen with people who have a lower titer. Does that now allow you to become infected again? We just can't tell. But the vast majority of people should be protected. Now, based on what we've seen with the SARS that caused the severe acute respiratory syndrome in 2002, and people have tracked this, it seems as if this immunity doesn't last forever. 2 to 3 years is what most people think that immunity would last for. And so what that means is that it's either if there's a vaccine around, you probably have to be boosted again. Otherwise, the amount of antibodies you have in the system could be low enough that it might permit the virus to come in and take hold.
All right. Let's see.
One thing, Pastor Wilson,
go ahead, Doc.
To the next one. It's important here because I want people to understand. If you have gotten the coronavirus and you have recovered, you still need to take the precautionary measures when you're around other people, because what we don't want is that there's individuals who have a mild symptom, they get better, and then they say, fine, now I don't have to worry because I already have the coronavirus and I'm immune. We don't have strong enough data to prove that. We think it's very likely, but you still need to take the precautions to protect yourself.
Right.
All right.
Because
all right.
even if you don't show symptoms, you could actually transmit it to somebody who might be more susceptible to those symptomology. Very, very good.
All right. Great. All right. There was a question here that I think NAC, about NAC. That one got me. Can you explain how NAC works? Does anybody know what that is? I don't know if that's medical term, but you want to take that one?
Yeah, that's like an amino acid supplement that is supposed to boost the immune system. Again, people are throwing around a lot of things, but again, if they're not tested in clinical trials, we don't know if they work, and that is what has not happened yet. So again, we like to speculate as a pandemic is ongoing, and people are speculating about a lot of things, hydrochloroquine and several other things. But until these things are tested and have been shown to work, the fact that they worked in some other microbe that might be related doesn't mean that they will work in this coronavirus, because what we've seen is that the things that we've seen with other coronaviruses, like MERS or even SARS-1, we're not seeing with this novel coronavirus. Where in the previous SARS, you didn't transmit it unless you were showing symptoms, right? In this one, you can transmit it without showing symptoms. And so I think we have to be careful with our homemade brews, and the fact that somebody might have taken something and then they got better doesn't mean that that's the thing that got you better. You probably would have gotten better without it. And even if you got better with it, based on your age, based on your immune status, based on even your genetic makeup, you might have responded very differently to that agent than somebody else with a different genetic makeup. And all of that needs to be tested in a clinical trial.
All right. Good. And you talked about hydroxychloroquine. And today I learned that FEMA shipped out near about 20 million tablets. And from the science perspective, is this the proven cure for this thing?
I'm not saying that hydrochloroquine won't work. If it works, I'll be very happy, because it's a cheap drug to make. We already know a lot about it, but it wasn't designed to treat a virus. It wasn't designed for this. This was an anti-malarial drug. In several people who have taken this, the reports have shown that they had arrhythmias. So it could have negative consequences on the heart, but we know that it's an anti-inflammatory. So maybe it will work. We don't know. And again, I think we should wait for the clinical trials. There are clinical trials ongoing right now.
But I think,
Go ahead, Dr. Knight.
Pastor Wellington, is it a proven cure? The answer is no. It's not been proven yet. We're hopeful. I think we're seeing it being used in some patients who have nothing else that we can offer. You know, when someone is really at the brink, you're going to try anything because you say, even if there's a chance it could help, let's use that. That does not mean if you don't have it or if you have a very mild case, you should be trying things that have not been proven. So we want to get the data. We want to have the science because every one of these substances can have potential side effects. We need the data to know that it's going to be helpful. And that's what we're doing right now. Studies are ongoing. Let's see that come in, but talk to your healthcare professional so you can make a decision about what may be best for the specific case that you may or your loved one may be in.
All right. We're going to come into some more questions on the Facebook here, but let me just do this. I feel that I think we need to, let's see if we can go with a round robin. All right. You're just going to answer myth or fact as best as you can. If it's not myth or fact, then you can explain it away. Okay. Myth or fact, most people live than die from coronavirus. Myth or fact?
Fact.
All right. I'll give you a simple one. Coronavirus, airborne, myth or fact?
Fact.
Fact.
Coronavirus caused by 5G, myth or fact?
Big myth.
Oh, but you both agree on it. You both agree on it. Myth. All right. Can garlic and ginger cure coronavirus? Myth or fact?
Well, if the garlic smells so bad that nobody wants to come near you within 6 feet, then it works.
All right. Here's the last one. Men are getting, they say, according to the Washington Post, men are getting sicker and dying more from COVID virus based on Spain data. Is that myth or fact?
That's fact.
Fact.
All right, that's fact. All right, let's get to that because they're all men here. Why are we more likely to die of this thing than women? Somebody explain that. Dr. Knight, take it away.
So we think it's multifactorial. Again, we're still learning, but there are certain risk factors that we see have been more prevalent in some of the men that we're seeing. So things like smoking, things like certain conditions or unmanaged diabetes, unmanaged high blood pressure. So there may be a lot more genetic issues, and our colleague may have more specific on that. Some of the data is very new, but what we've seen observationally, meaning that we look at who has been affected and see what's in common, we do see higher rates of certain comorbidities in the men, and unfortunately they've been affected.
All right.
Yeah,
want to follow?
Yeah, I agree completely. It's not very clear if there is any single entity that stands out. Others have speculated that more men smoke than women, more men vape more than women, and it is thought that all of these things, both of these entities actually reduce your lung sufficiency, reduce lung capacity, and that could lend itself to you having greater symptoms at the time when you acquire the coronavirus, and that could lead to a greater mortality.
All right. So let's go back to some of the questions online here. We're going to go with Jerry. Jerry has a question. He's asking, is it still safe to go out for a walk or jog for exercising, or just stay home and stay safe?
I think if you have a good area that you can go out and jog, that's a good thing. It's good to get fresh air. The virus is not some mysterious entity floating around in the air. If there's nobody around you, if nobody has coughed or sneezed, you won't get the virus. However, if you're jogging, it is better to jog beside somebody than behind them. Because if somebody sneezes and they're jogging, depending on direction of the wind, it could blow the virus far greater than 6 feet. And you could put yourself at risk. But again, when you're in the outside, even if you cough or sneeze, the amount of virus, the viral load is significantly diluted because it's dispersing much faster out in the air. So I think the risk is certainly lower.
All right. Let's take this one. Dr. Knight, Francine Brown. What are your thoughts on individuals who have the BCG vaccine? You want to take that one away?
Sure. So this is another one of the things that we're seeing. So there was a question, and that we said, well, maybe we've seen many countries that routinely give the BCG vaccine to their constituents, and we're seeing lower rates there. So the question was, was there some kind of cross reactivity or something? I think the data has not shown that it's proven that the BCG vaccine is something that makes you immune to the coronavirus. So just because you've had it does not mean that you are not or cannot contract the coronavirus. However, some of the data has been shown that maybe there's a reaction that has become in your body, in your immune system, as a result of that vaccine, that may lower your risk for severe symptoms. But I think the data is very early at this point.
All right,
Yeah.
good. Somebody here is saying that their brother was cured from this hydro. Uh, and I think that's spelled wrong, but we know what the medication we're talking about, and they're restored to normal life. Do you think it will have any life-threatening issues later on? Well, first of all, I think we just want to say thank God that somebody has been healed, somebody has been restored from it. But, any comments from that on that?
Well, as I said before, hydrochloroquine has been known for a long time. This is not a new drug. It has been tested in humans. It has been given to humans. The reason why it was withdrawn from some of these malaria trials is because the bug developed resistance to it. So, it's not detrimental if you take it at a dose that's prescribed by a physician. Again, we're not saying that this will not work. All that I'm saying at this point in time is that I would love to see some more data on this. I would love to see a couple of clinical trials with a larger number of people, where you actually have some controls, where some people get it, other people don't get it. You have a placebo or some other double blind study that is being done to test this. If a doctor taking care of a patient feels that that patient would benefit from it, then all good. But to use it as this one fix for this pandemic, I think it wouldn't be prudent to do that until there's evidence that this is actually working.
All right, you want to say something, Dr. Knight? Then I'm going to.
I'm
All
in
right, no,
agreement. I'm in
good.
agreement with that.
There are some folk who are commenting online, and I guess they're having a conversation on the garlic comment and the ginger. They still feel that they may have had may have slighted them, and they feel that it may be some strong evidence to support a natural use of garlic
Well,
or ginger.
let
You guys want to respond to that?
well
I
let
think we were just making a light moment. We're not being slighting or anything, but anybody wants to comment on that?
Yeah, Pastor Wellington, I think it's important because we have to think about the terminology that we're using. Is ginger and garlic a cure for the coronavirus? The answer is no. Are there health benefits to ginger and garlic that could potentially help someone who is infected with the coronavirus? The answer is yes. So while it may not be a cure, we know that garlic and ginger and a variety of other health products like vitamin C, we've talked about zinc, all of those have been shown in a variety of other spaces to help to strengthen the immune system. So we know that a stronger immune system is going to help you battle something. So it's not saying don't take ginger and don't take garlic. If that's something that's not going to or counteract with any other medications you're taking, go ahead. I'm not saying don't use it, but I'm saying don't have a false sense of security that says, well, I'm going to go out to my friend's party, or I'm going to go over to my friend's house with a group of 10, 20 people because I took my garlic and my ginger last night. That is a dangerous situation. However, if I'm dealing with something, an infection at home, and I said, let me take this as a part of a larger strategy to improve my outcome, then yes, that is recommended.
All right,
And
great.
moreover, you do need to hydrate anyway. So having a nice drink of ginger or pineapple juice or something else that somebody was mentioning, that would be a good thing if that's what you like and that's what you care about, and it will help you to hydrate. Then I agree completely with Dr. Knight.
All right, good. Thank you very much for that clarification. Now, having said that, so these items, these home remedies, don't provide a cure. And in terms of the news, there's some news out there that they're looking for. This thing could be with us for about 12 to 18 months. until a cure in the form of some sort of a vaccine is developed. Uh, is the vaccine the only way to cure this thing? Is that the solution? And when will you think that will come
Mhm.
to fruition? Do you think it's really 12 months out, or longer than that, or shorter than that?
So we have to understand again the terminology. Vaccines are not cures. Vaccine prevent infection in people who don't have the infection. So if I take a vaccine for measles, it's to prevent me from getting measles. If I already have measles, you're not going to give me the vaccine to cure me. So there are a lot of diseases or viruses that we don't have a cure for. We may have a vaccine, we don't have a cure for it. So I think what we're looking at is 12 to 18 months that we could have a vaccine to prevent healthy people from getting the virus. But as far as a cure, we still have, that may be even sooner than that. We don't know. That's why the studies are happening right now with hydroxychloroquine, with other antiretrovirals to see if that will be a cure. But a vaccine is prevention.
I appreciate that clarification and that edification in terms of the prevention element and all of that. Now, somebody else asked a question here about this virus on the timing. I'll bring this up. This is Camille Anderson asking, is there any evidence that the virus is lasting longer than the expected 14 self-quarantined period? I think that's a great question to first put up.
Yeah, I've seen studies that have shown that even after 36 days, individuals who no longer show symptoms still have viral shedding. Now, this was a PCR test. In other words, they're amplifying the nucleic acid of the virus. So it could mean that these viruses are not whole. It could mean that they're fragmented and you're still picking the viral part, nucleic acid up. However, I think there is enough evidence there to say that people could still shed the virus after this 14-day period. And again, you're talking about different people who got infected with different immune status. And depending on how strong your immune system was at the time when you got infected, it's not unusual that the virus could be sitting around in smaller amounts. As to whether or not it's transmissible and what it would take to transmit that, I think that's an area where studies are still ongoing.
All right, so Dr. Knight, and I know you work in this area too, Dr. Webley. So let me toss to Dr. Knight, and then you can pick up on this also. In terms of the vaccination process, you
Mhm.
get a vaccine, and if you take it for, let's say, a flu vaccine, that flu vaccine is for one strain of the flu. And if it's that strain last year, as my wife educated me, it may be a different strain this year.
Right.
Does that apply to this COVID-19, this coronavirus? If a vaccine is developed and the strain on this 19 strain, will that only prevent that 19 strain, or is it potentially uh, something that can move on and grow again?
Right. And I look forward to the microbiology piece to that. But I think on the clinical side, that's a part of the testing process. That's why you can't have a vaccine in 2 weeks. You have to see, are people mounting an immune response? Do people develop immunity? And does that protect them from the coronavirus strains that are out there? The flu is different, like you said, because every year we see different strains. That's not the same as, for example, the measles, right? So the measles is not a different strain every time. It's the same vaccine. And if I get it, it's covering me for a long time. Hepatitis B is similar. So I think that's a part of the viral development process. But I think on the microbiology, we could potentially hear a little bit more about the potential for a singular vaccine.
All right, Dr. Webley.
Yeah, at this stage, there is no indication that this virus is mutating appreciably that would make a vaccine that is developed now not work in a year. Again, you're talking about a microbe, so it might change. One of the things with this virus is that unlike some RNA viruses, it actually has what we call a proofreading system, which means that it doesn't mutate at the same rate of like an HIV. The vaccine that they're making now, well, there are 40 something potential vaccines now that people are looking at making. But for the most part, these vaccines are actually looking to make an antibodies that bind to the area of the virus that attaches to the cell. In other words, it's like going and breaking off a key in the lock. Even if you come with a key, you can't open the door. And so essentially the hope is that vaccine would actually work once developed for long term for this particular virus. But again, remember that a vaccine doesn't prevent you from getting infected, right? What a vaccine does is that it prevents you from developing disease once you become infected with the virus. When you're immunized against any entity, whether it's a virus, a bacteria, or whatever else, you make an immune response to that vaccine entity that hangs around in your body. You have antibodies, you also have memory cells that remember this entity. So when it comes in, you actually already have an arsenal because it's in the database. So you're able to protect against it. It doesn't prevent it from coming in. In other words, this virus could still be floating around. And if anybody who is not vaccinated, like what we see with the measles outbreak, so many people are vaccinated, but those who weren't vaccinated were able to get it, and they are able to transmit it to people who are not vaccinated. There might also be people who, because of their health status, are not able to get vaccinated with COVID-19 vaccine once it's made. And people can't get vaccinated for various reasons. Those individuals would also need to be protected. And so what you would need an appreciable number of the population to be vaccinated. So we develop what is called herd immunity, where there's so many people who are protected that it prevents the people who are not vaccinated from getting the disease.
All right, so Don L, he's asking then, just a follow-up, he's asking, are we required to take vaccines? And I've just modified that question a little bit more to say, if this vaccine were to be developed, as scientists and as doctors, internal for you, doctor, internal medicine for you, or medicine for you, Dr. Knight, would you recommend that we all get the vaccine?
Mm-hmm. So that's, see, another terminology piece here. Recommended versus required. So all vaccines, I may recommend the flu vaccine, I may recommend the tetanus vaccine. If you say no, am I going to kick you out of my office? Am I going to take you out of your job and put you out of your home? That's not something I'm doing. However, I will say that and this is a different time. You know, we're dealing with a virus that has made such a large impact on society. We don't know what the requirements may be. We do know that there are certain areas, for example, that if you don't get your child vaccinated, the child can't be enrolled into school. So I'm not saying that there may be no strong recommendations, particularly in areas like New York, where there's such a significant impact. There may be very strong recommendations, but as far as required in this country, we have not seen any national requirements that everyone get any vaccine. There are many people in this country that have never had a vaccine, and no one is at their door forcing them to do that.
All right, all right.
Great.
I think that's so. I think one more question. There was one more on. Never asked this one is so. It's COVID-19 an autoimmune disease? All right, I
No.
see you shaking. Both of you shaking your heads. Who wants to take it first?
An autoimmune disease is a disease that essentially attacks your immune system. Autoimmune diseases like lupus and Sjogren's syndrome and some of these diseases, it's really your body attacking itself. And typically what happens is that, you know, like in the case of lupus, you actually have antibodies being made against your own DNA proteins and DNA binding proteins and some RNA proteins and a variety of proteins in your body. It's really a cross reaction and a mistaken identity, so to speak. That's not what's happening with this virus.
All right, all right. So I think that gives their answer to her on that one. So it's not an autoimmune, but your immunity needs to be up there. So somebody's asking about flattening the curve, and then we're gonna go to some countermeasures, which I had in my notes here about the curve. Is this curve a PR stunt by those who put this curve out? Um, Let me put another question up here. Somebody says, Camille says, elaborate on flattening the curve because many people think it means the virus is gone. Please clarify. I know you got something to show us, dear Dr. Webley. So you're
Are you
doing that.
seeing that slide?
Talk us. Yeah, there we go.
So essentially, the idea about flattening the curve is that no healthcare system has unlimited capacity. In other words, you have a certain number of beds in a given state or a given locale. You have a certain number of doctors and nurses and healthcare workers and first responders. And if you have enough cases that go above that capacity, then now your system is overwhelmed. then you have to make a decision who gets a ventilator from who doesn't, who gets taken to the hospital from who doesn't. Are you taking in other patients who don't have COVID-19, who need your care at that time? And so the idea of flattening the curve is getting to a place where your healthcare system is not overwhelmed. You're managing the cases. It doesn't mean they're gone away. The fact that the curve is flat doesn't mean that the curve is not there. The viruses are still infecting. You still have people infected, but you can handle it as a locality. You can handle it as a hospital system because you have the capacity to do so.
And so let me ask you then, on terms of on one in New York, for example, they estimated, I think it was Columbia University or so, estimated that it would be just over 100,000, and then there was another one the governor talked about that was about 70,000, and right now we're somewhere between the 30,000 or 40,000 they're expecting. Does that mean then that because the numbers are lower than they expected, that we're doing good and that this thing will go away rather quickly, or do we still need to, because the curve is flattening and we're coming out on the other side, do we still need to take precaution?
Well, if you notice today, as it was a few days back, the curve is flattened. You're not having that steep rise anymore. But what do you see? You're seeing that you're having similar number of deaths still, right? It's flattened,
Right.
but it's not going down, right? People expect that if the curve flattened, all of a sudden you're going to have it dropping
Right.
very rapidly on the other side. But if you notice, that's not happening. What needs to happen for that curve to completely drop is that the number of cases have to slow down significantly. And that requires mitigation. That requires testing, knowing who is infected, since we know that you can transmit the virus without having symptoms, quarantining people who are infected and those who they've come in contact with, so you can break the transmission. Until you're able to break the transmission, or until you have enough people infected and immune in the area, or until you have a vaccine, you will not get the other side of that curve to go down significantly in any area.
So are you saying then that, let's say they start to reopen the, we're in another couple of weeks or so, few weeks, are you saying that part of that process should include uh, it, testing of everybody as they go, or as much as possible?
Yeah, how would you know if the person you're standing next to in whatever sector you work is positive? How would you know if that person can transmit and all of a sudden you get an upsurge again in infections? So, again, this rollout of additional services beyond what we have now has to be very thoughtful. And I would say that if you're going to sequentially open places, testing has to be a part of that, to know who is infected, who is going to transmit. If you're not ahead of it, you see, we've been playing catch up all this time. We have never gotten ahead of this virus. So we're running behind it and mopping up behind it. In order for us to get to the place where we're comfortable opening everything again, we have to get ahead of it. And the way you get ahead of it is to test and test and test. We are just
All right.
not running enough tests. It seems as if we don't have the capacity to test. You have tons of people right now who are recovering from COVID-19 who have never gotten a test.
And several people who have had it and didn't even know they had it, right? Because of
That's
the
correct.
Right.
And there are people who have had it and have been in quarantine and don't know if they should break quarantine now after 14 days because they don't know if they still have it. Because not only did they not get a test, and even if they got a test to confirm it, they can't get a second test to determine if it's gone. If you remember, in the early days of this disease, the WHO standards were that you had to test negative twice in a 24-hour period to say that you were negative, right? Nobody's getting a second test right now. So how do we even know that the people who we've quarantined and they're coming out of quarantine after 2 weeks are actually negative? We don't know that.
Completely. All right, great. All right, so we've got only a few more minutes left. So let's talk about some countermeasures, some takeaways, and what you can recommend as countermeasures for not just the healthcare, but for the individuals to kind of deal with. The governors of these states have been saying, stay home, wear masks, stuff like that. I'll put one out. I have seen in various cities that they have been cleaning these cities, like washing down the cities with whatever detergents or whatever they use. Okay, so mass cleaning of cities from a scientific standpoint, based on the residue of how long this virus lasts on metals and plastics and all these various materials, is this something that you think should be done or needs to be done, or it's really not that important from a scientific standpoint, as long as we take care of ourselves, wash our hands, wear gloves?
I think it might have some effect, but again, uh, we're not testing enough people to know where we actually need to do something like that. I mean, most people who are getting infected are not getting infected because they're walking along the roadway. They're getting infected because they have come in contact with somebody who actually has the virus. So the truth is that I would put way more resources into increasing testing capacity, into personal protection for people who work at nursing homes and hospitals and hospice care and the other areas where people are consistently being exposed to the virus. I'm not saying that there's no efficacy in washing the streets, but I can't imagine that that is changing the numbers significantly.
All right, so that's not necessarily consequential, basically, in an effort. All right, so what are some other countermeasures that you think we could recommend?
Well, I think one of the things to understand is there's no one thing other than what we've seen as distancing and washing hands that has this huge effect, right? We're looking for a cumulative effect, meaning we're looking for an additive effect. So when you think about street cleaning, you think about social distancing, staying home, washing your hands, wearing a mask. These things we're hoping are going to add up to decrease the risk. However, each one of these things by itself is not enough to bring that risk down to zero. So when someone walks out of their home in a mask, does that mean that you're not going to get it if you get close to someone at a store? No. Does it say that it may reduce your risk of passing it on to someone? Yes, reduce, but not eliminate. So I think when we think about the ways that things, washing hands, 20 seconds, and people talk about that so lightly. The reality is most people do not wash their hands for 20 seconds with soap and water. And think about the last time you went to public restroom. People are not washing their hands for 20 seconds with soap and water. So even simple things like that, we can't discount for the effectiveness that it can be to reduce the transmission.
All right, great, great.
Yeah,
Doc,
and
you
I
have something
think
you want to show us?
Yeah, I think, even with the masks, it's going to be important that people understand that, as Dr. Knight said, this is not foolproof. As you can see, there are different levels of masks. Right now, they're telling us to do the DIY masks, and it's not clear to me how much efficacy that has, because if you hold any piece of these pieces of cloths up, whether it's a handkerchief or anything, and you spray something, you realize that the spray goes through it. So it's not clear to me that this is actually having any great effect. Even your surgical masks, you're having that, and then we tell people to wear them. We're not giving as many instructions about how to take them off. And if you have to wear them more than once, how do you disinfect them? Mm-hmm. Or is that even possible? The N95 respirators are, of course, the most effective ones, but as you can see, it's tight fitting. And the regular public can't get them. But even if we could, it's something that not everybody should wear. If you already have a respiratory distress, respiratory disease, you probably don't want to wear an N95 respirator for any long period of time. Right. It would give you shortness of breath. And so, when we wear N95 respirators in our research lab, you have to be fitted for it, because not every brand fit you close enough to offer protection. And so again, I see people wearing them and they're not covering the nose, they're covering the mouth, or it's not fitted tightly enough around. So I think that the physical distancing, the hand washing, as Dr. Knight said, is such an important thing. Mm-hmm. If you can think to yourself when you go out, everybody around me is infected with COVID-19. Tell yourself that. Everybody around me is infected. How would you act? And the way you act in that situation might help you not to get it. Or you tell yourself, I'm infected with COVID-19 and I don't want anybody else to get it. It means you're not touching your face. You're not touching surfaces. If you touch a surface, you're cleaning it in your home. You're using 10% bleach to wipe down your counters and your doors. And by the way, your 10% bleach has to be made up fresh every day for it to maintain its efficacy. And not every bleach that you buy is the one that has the ions in it to kill. If it doesn't say kills 99% of germs on it, it probably is just a whitening agent for your laundry and doesn't have that efficacy. So I think all of these things are important. If you're wearing a pair of gloves, how do you take it off? How often are you changing it? Are you touching your cell phone with the gloves and then putting it back in your purse? That kind of defeats the purpose of having these entities overall.
All right. Thank you. So let me just ask you then, in terms of wiping down everything and making sure that you clean everything, spray everything, door handles and all of that. You're saying to us that there's some cleaning agents that work and some that don't work. Is that what you're saying? That we should be
Absolutely.
mindful of?
Yeah, I mean, if there's something you can wash off with soap and water, by all means, that's going to be good, right? Because you don't have to kill the virus to get rid of it. Yeah, you can wash it away, right? And the thing is that it hides underneath oils, and that's why we use soap on our skin, because the virus can get trapped in oils on our skin, and that's why you use a detergent. You use a soap that has a surfactant in there that peels away that oil from your hand, and that's why you wash for that period of time, because it takes that amount of time for you to wash away those natural oils, and then with it the virus. The soap that you're using doesn't have to be antibacterial. In fact, it's better if it's not antibacterial, because it removes that false sense that you're actually killing the thing. You're just washing it down the sink, right? And so that's all you need in order to get rid of it.
All right. All right. We've been trying to bring these points home as Carly just said here. We're trying to bring these points home to everybody, trying to make sure we help everybody kind of understand, break down COVID-19. I want to thank you two gentlemen for spending the time with us. We're going to give you the opportunity to kind of close out with some closing statements. So I'm giving you an opportunity to put your thoughts together as we kind of help to bring a closure to this whole discussion that we have had this evening. But I'd ask this: what should a person expect if they get tested positive? Is it a death sentence or is there hope? Dr. Knight.
There's definitely hope. When we again look at the numbers, there are more people that have recovered from coronavirus than those who have died. So it's definitely not a death sentence. What it may mean for you is going to vary depending on your health status, depending on age, depending on a variety of other factors. I have patients who have felt almost nothing, like a little mild cold, and I've had patients who've been in the ICU. So it does vary from person to person. I think we shouldn't be scared about it so that we don't take steps that we need to do. We need to understand the facts. We need to understand what is proven and stand on those things. And then anything else that's we're adding to strengthen ourselves, let's add it on. As long as it's safe, that's fine. But we have to know what the facts are and what are the best ways to protect ourselves.
All right. And we really don't know. None of us are immune from this. So there's no stigma that anybody should take away or add to themselves if they get this virus, or is there?
There's no reason to be ashamed. This is a global pandemic. The last one we had was in 2009 with the influenza pandemic. In a global pandemic, the important thing is, number one, take care of yourself. Eat right as much as possible. Get some exercise. Get outside and walk around if you can do it safely. If you can help your neighbors from a safe distance, do that. This is a time to show kindness. This is a time to be thoughtful. This is a time for reflection on what your community mean to you and what you mean to your community. I agree completely with Dr. Knight. This is not a death sentence. Fully 80% of people who seem to be infected with this virus show very little to no symptoms at all. Another maybe 13-14% have mild to moderate symptoms, but don't need to be in the hospital. They can stay home and recover. It's only that last 6 or 7% of people who have severe cases, and those are the people who end up in respiratory distress. Those are individuals who have that cytokine storm that we talked about, and might end up on a respirator. And even people who are going on respirators, we're seeing more and more of them coming off respirators and returning to normal life. So we can be hopeful. And I think instead of being negative, instead of getting to a place of hysteria, it is good to be thoughtful, to be wise in the way we interact, to obey the physical distancing norms that have been put in place. Don't go out there and be a hero. We see too many people, especially people in religious circles. We saw a pastor die needlessly because he refused to social distance or to physical distance. There is no need for people to lose their lives at this time unnecessarily. There are people like nurses and doctors who go out there and put themselves out there to save us, to make sure that we can survive this thing. There is no reason to go out there and needlessly expose ourselves because we're believing some myths. Stay off the videos with unknown people with British accents about 5G and that nonsense. Stay away from that stuff and focus on what you need to do to improve your health and that of your family and your neighbor.
All right, and I know you put something in there. You threw something in there about us clergy, so I know you all are the doctor's side. I'm gonna have to respond to you. I'm gonna have to respond to you. For the record, all our churches are closed. Okay, we're live.
That's right. That's right. You've been responsible. You've been responsible.
We're responsible. We're helping to flatten the curve and to take care of our people and make sure that they're well. Dr. Knight, give us your closing thoughts.
Right. I think one of the things we have to do is trust in our supporters, trust in God, trust in our health system, that we're going to get through this. And we really hope that you don't interact with coronavirus. But if you do, there is hope. There is support. Speak with your healthcare provider. If you have questions, if you hear something that doesn't make sense, reach out to someone in the healthcare field that can help get you factual information. We're not just dealing with a pandemic, we're dealing with an infodemic, meaning there's so many myths and incorrect information going out there that it's killing people. People are having bad responses to trying to use medications they shouldn't be using to try to cure something that's not going to happen. So we want you to know the facts. Come on programs like this to hear from experts, check their credentials, and really support each other. When you hear something good, share this information, because this is how we can empower our communities to have the best outcomes. We know it's attacking the African-American community. We are bearing the brunt of this situation. So we have to take stride, and we have to take efforts to put an end to a lot of myth and also empower ourselves with the right information.
All right. Thank you very much, Dr. Knight. Dr. Webley, your closing thoughts.
Thank you very much, Dr. Wellington, for giving us this opportunity tonight. Thank you, Dr. Knight, for your insights as well. What I want to say to those who are viewing is we are in an unprecedented time. 2 months ago, we could not imagine ourselves working from home, doing school from home, sheltering in place. We could not imagine the shelves of our local supermarkets being emptied of toilet tissues and hand sanitizers and all of these things. We truly are living in unprecedented times. It is important that whatever our religious sway, whatever our political leanings, we have to remember that viruses don't care what you believe. They don't care which political party you belong to. They don't care which country you're from. Their singular purpose is to make more of themselves. They don't mean to kill you, but they will if they have to in order to make more of themselves. Their goal is to replicate. And sometimes as I do my research and I think about the bugs that I'm working with, if I spend enough time thinking about it, I kind of give them personalities. And so, oftentimes I think about these viruses that when their host dies, they have a Steve Urkel moment, like, oh, did I do that? They don't want to kill us. They want to live. They want to be able to propagate. And so if we take the precautions that we're supposed to, if we keep the physical distancing that we're advised to do, even if we don't like it, if we look out for our neighbors, if you know that you're strong and you're healthy and you don't necessarily are susceptible, you might bring it to somebody who is susceptible. Do you really want to be responsible for causing morbidity and, God forbid, mortality to those individuals? So what I want to say to people is, take care of yourselves and take care of each other. Take this moment to reflect on what life really means. Take this moment to reflect on the value of life as it is. This too will pass. We know that. We have to be patient, we have to be vigilant, and we have to utilize all the resources we have at our disposal to make the best of what is really a bad situation.
All right. Thank you very much, Dr. Knight and Dr. Webley. We're just so happy that you spent the evening with us. Thank you to our viewers for watching. We hope you have learned a lot tonight and that you have been encouraged by the information, the science. Don't fear. In fact, the scriptures say in 2 Timothy 1 and verse 7 that God hath not given us a spirit of fear, but of power and of love and of a sound mind. If you are a spiritual person, hold on to the one who is the great physician because he does grant healing in even in pandemics. Thank you everybody for watching
Man.
and you have a great evening. God bless you. And remember on Friday night we have another Pray for New York City on Friday night at 8 p.m. right here. We'll have a special guest coming to us on Friday night, and you don't want to miss that broadcast. Dr. Michael Knight, thank you very much. Dr. Wilmore Webley, thank you very much. God bless you.
Thank you.
Thank you.